This is me, Gayatri Prakash, and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 28th of January 2023 OET exam. So first of all, I would like to discuss with you about reading. So what was the topic for reading? So this is from my students who were written the exam in India as well as in Europe countries and Gulf countries. Okay, so the topic was hyperhidrosis. This is from India. And Parkinson's, Alzheimer's. This is from Europe as well as Gulf countries. So this was the topic of part A, reading. Okay. And how about the listening? So the listening topic was like talking to a doctor, a patient and doctor conversation, which is between the rheumatologist as well as the patient. Another topic was like talking to a GP. Okay. Now, the third thing is like speaking topic. What was the speaking topics? First one is emergency department setting, in which a mother came to the emergency department and talking to a nurse about the son who is suffering with severe constipation. So the nurse is explaining about how to overcome the constipation at the home itself with the home remedies. And second topic, the same emergency department setting. So here a person who is coming to the emergency department because of vomiting and diarrhea, so waiting for the doctor to look after the patient. So the nurses assessing the patient and giving advice, and they are making the patient to wait for the doctor. And setting number 3, which is home visit. A community nurse making a home visit to a appendicitis-ectomy patient, like who had completed acute appendectomy surgery, and the community nurse is going for giving an IV antibiotic injection. So that she is making a home visit and talking to the patient and giving an antibiotic. And second setting was like same home visit. So here a person who is a community nurse visiting a patient at home and who is having the itchiness. So she is giving advice regarding how to overcome the itchiness. And third setting was hospital ward. Here a patient who was treated for stroke and getting discharged, and patient need home help service at home after getting discharged from the hospital. So the nurse is helping for the patient and educating the patient how to take care of them at home. And another setting was community health center setting. A patient came with a complaint of cough, and the patient is a chronic smoker. So the nurse is advising how to quit the smoking. So these all are the speaking topics which were asked during the exam time on 28th of January 2023. So now we are going into the main part. It is the writing task. So what was the writing task? So it is from Europe countries and from Gulf country and from India. So this was the topic they have asked, and that is the one I'm going to clearly discuss with you all. Okay. So if I have missed any of the points which is related to the writing, you can just make it in the comment sections with what points which I have missed it. Okay. So let's move on to the task. So what was the task? So here we are writing a letter to a physiotherapy manager who requires, like the patient requires physiotherapy exercise programs and assistance for the mobility after getting discharged from the hospital to make a home visit by a physiotherapist. Okay, so it is a letter we are writing to a physiotherapist. So what is the patient name? Patient name Mrs. Jane Hardwick. She is 50 years old lady. She was admitted into the emergency department due to fall from a ladder at home. Thereby, her L3, L4 were fractured and she got aneurysm rupture. Due to that, she suffered with hemorrhagic stroke. So which all diagnosed with the help of a CT scan. Thereby, she has undergone craniotomy procedure and they have done a coiling in that procedure. And from that procedure, she transferred to the intensive care unit. After she got recovered from that intensive care unit, she was transferred to the highly dependency ward. There, she was initiated with the physiotherapy, occupational therapy discussion was held, and also she was discussed with the home care assistants. So here, a patient needs highly recommended physiotherapy because after gone to the highly dependency ward, patient developed left side weakness, slurred speech and a lethargic. So thereby, patient was assisted by a physiotherapist and started a exercise program for the patient. Patient slowly started to walk with the help of pickup frame, and later on, patient started to walk short distance with the help of stick. However, patient needs how a patient needs family members assistance after getting discharged at home. Okay, and then they have done an occupational therapist assessment on patient, and the occupational therapist, they have said to the patient is fit for discharge. However, patient has to walk with the walking stick while they are climbing the stairs, because patient is fit to climb the stairs. That was done in the assessment. And then home help assistance, because his wife is suffering with kind of a condition. I think she also suffers with kind of a stroke or something. I'm not quite sure about it, but the wife is not fit to take care of the husband. So the home help assistance was discussed with the family as well as the patients to know the needs of the patient before getting discharged. Regarding the social background, patient lives with his wife, who is also suffered with a kind of underlying medical condition. Patient is already suffers with depression, asthma, and he is a drinker, and also he is not compliant with the medication regimen. Apart from that, patient is also having the like hemiplegia, already left side hemiplegia, and also he is a left-handed person, left dominant handed person. And apart from that, patient is like, what to say, regarding the social background, these all are the main points which has to be known by a physiotherapist. Apart from that, nothing else more to say. And recommendation paragraph, which means discharge. So why we are writing this letter, which means the patient definitely need a physiotherapy to help the patient for strengthening the muscles as well as to improve the mobility, and also to bring his life as back to the normal, like rehabilitation program necessary from the physiotherapist part. So these are the letter informations which has been given in the letter. Okay, so now how we are going to write a letter? It is a completely unknown case letter, because we are writing a letter to a physiotherapist. It is unknown person of the patient. Okay, so now coming to the point of introduction, how to write an introduction. So here you can write, I'm writing to request your home visit. This is the way also you can start. Either you can start like this also: Mrs. Jane Hardwick, who requires your home visit for, so let me read what I have written it here. So Mrs. Jane Hardwick, who requires your home visit for ongoing exercise program and assistance from your facility after her discharge. She is recovering from craniotomy procedure. Either you can write like this, or else who has been diagnosed with hemorrhagic stroke. Like that also you can write it. Nor you can write who has left side weakness and slurred speech. This is the way also you can write it, because these all are the current problem of the patient. So the diagnosis can be written in three ways: who is recovering from craniotomy procedure, or else you can write who has been diagnosed with hemorrhagic stroke, or else you can write it who has left side weakness and slurred speech. So from this you can write it, but the purpose is very important. So once again I'll read it for you all. Mrs. Jane Hardwick, who requires your home visit for ongoing exercise program and assistance from your facility after her discharge. So what is ongoing exercise program? Because the physiotherapy program was already started when the patient was in the hospital. So that's why we are mentioning ongoing physiotherapy program. Okay, we are not newly going to start the physiotherapy after the discharge. It has been started already when the patient was in the highly dependency ward itself. Okay, that's why we are mentioning here ongoing physiotherapy program that has to be continued at home for the patient. Okay, so this is the way we can write an introduction. Next, coming to the present medical history paragraph. Patient was brought into the emergency department on 21st of December. So we can just start like that. Mrs. Hardwick was brought into the emergency department on 21st of December following a fall from a ladder at home. On assessment, patient was found to have L3, L4. On assessment, patient was found to have aneurysm rupture, L3, L4 fracture, and also patient was found to have like hemorrhagic stroke with the help of a CT scan. Therefore, patient has undergone craniotomy procedure and coiling has done it. Coiling was done. So like that we can write post-operatively patient received adequate treatment and management. Because why we are not mentioning here the drug's name and what kind of antibiotic you have given, because it is not relevant to the physiotherapist, because physiotherapist is a person who is going to look after the patient, physical parts of the patient, not underlying medical condition which is related to drugs or which is related to the procedures, but just he wants to know what was the reason for the admission, what was the reason behind the weakness, slurred speech, and what is the problem for the patient which is related to the mobility of the patient or pain related to the problems. So in that situation, it is not necessary to give importance to the medication part. So that's why I'm returning post-operatively, patient received adequate treatment and management. That is more than enough. During hospital stay, patient developed a left side weakness, lethargic and slurred speech. Therefore, he was initiated with a physiotherapy program and started to walk with a pickup frame for a short distance, and that pickup frame was changed into the walking stick. In addition to that, an occupational assessment was conducted on the patient, and they have given fitness to walk on the stairs with the help of a stick. However, patient needs family members' assistance at home. Like that, we are just written it. So this is more than enough for the physiotherapist to know about the patient condition. So coming to the point of social background. So in the social background, what the physiotherapy about to know about the patient, which means who is at home, because the physiotherapy is making a home visit, right? So he has to talk to someone about the patient condition, what he needs, like that. So that patient patient lives with who, and what kind of the medical condition which is related to his which is related to the physical part. For example, patient was already having the problem of like left hemiplegia, and patient is a right side dominant person. So these things are very important for the physiotherapist to know. So we can write it, Mrs. Jane, Mrs. Hardwick lives with her husband who is suffers with the underlying conditions and not fit to take care of the patient at home. That is very important thing. And second thing, you have to write it, he has a history of left-sided hemiplegia and right dominant hand person. So that two things are very important to that. If you want, you can write like she is an alcoholic and a depression and asthmatic patient. So this is just for the hint, we just give it to the physiotherapist to know about the patient, but not necessary to mention about the medication part, because it is not belongs to the physiotherapist to know it. And then coming to the point of recommendation, so it would be highly beneficial if you could pay a home visit after her discharge to help her or assist her in activities of daily living by improving the mobility. So this much is more than enough to inform to the physiotherapist. Then you can write, your concern on her condition is highly appreciated. Most importantly, assist her in mobility and to improve her muscle strength. These things we can add it. So that's the letter. And conclusion, please contact me for further details. If they have given name in the address, you can just conclude the letter yours sincerely. If they not given, you can conclude the letter with yours faithfully. So this is the way we are going to write the letter. I hope overall you all got an idea how to write exactly the letter for the physiotherapist. Hope for the best result. Okay, so whomever wants to join in our class, our number has given in our description, so you can contact us at any time and join for the class. Okay, so we have 30 days, 40 days, 20 days, 10 days, and we have a mock batch crash course, and also we are just having 2 modules classes like writing and speaking, and 4 modules, and the beginners batch. This all the batches are running. We are only having online coaching, so you can contact us at any time by calling our number. Okay, so until then, bye bye.